Doctors, surgeons, nurses of Reddit. What's the worst thing you experienced while at work? Taking care of a fall patient that broke her pelvis. She just found out her husband had cancer and she wouldn't be there for him. She was crying, telling me that he was there for every appointment and treatment when she had cancer, and now he'd have to go through it alone. Story 2. When I was a CNA, I got into a situation where I didn't have gloves on and got poop on my hand. I scrubbed like everything after and moved on with my night. A while later, I absent-mindedly chewed my fingernail and tasted, you guessed it, poop. I vomited and dry heaved, ran to the bathroom and scrubbed my mouth out with soap. It took a while for that taste to go away. Story 3. Watching another nurse pulling a fall mat away from a patient's floor next to her bed. When asked why, she said in front of the patient, she about to die anyway. Her mouth was stuck open because she was so emaciated, but she could still cry. Her frozen face somehow allowed her to still cry after she heard that, and she did for a long time. I sat there with her. The PT was in custody of the state, a mental hospital, and they chose to withhold food and water, a type of forced DNR. She was around 90-something. We were forced to watch her slowly starve to death. I quit right after that. Story 4. Former paramedic got a call for what turned out to be a very dead man who had passed alone in his apartment. His body was filled with gas, fairly common. As I'm standing by the body calling the hospital to give them a heads up about what's about to come their way and get approval to move, new EMT decides to poke gas-filled body. It explodes. After hundreds of showers, I could still smell on me. My SO at the time said every time she nuzzled me or got close to my hair, she could smell it too. It was like that for about a week. Still makes me gag to think about, and that kid's life was pretty much permanently changed. Story 5. I frequently experienced terminally ill patients dying in excruciating pain with no euthanasia laws to support them, and people like my mother, who was also an experienced ERRN, and who also asked for similar assistance when she passed. Story 6. This case in my internship made me give up on specializing in pediatrics. Boy got brought in for rheumatic heart disease, already in heart failure. Apparently this all started from a minor skin infection and went all the way up into his heart valves. We met him already in the PICU. He was still conscious and able to talk, and so for his first day, we built a sort of rapport. The next morning, before my friends and I clocked out, he wasn't looking so great, so the resident in charge called in the general surgery team to perform a cut-down to expose his veins for access. I had to hold down the poor kid during the procedure since local anesthesia could only do so much. He was screaming, so I told him, "Just hold on, we'll get through this." He nodded and said, "Okay." That was the last conversation we had. When I came in for my next shift, he was already intubated. The only parent with him was his father, since his mother was employed overseas. Now, for many of these cases, a letter to the employer is needed to explain why so-and-so must go home in this case of family emergency. I volunteered to draft the letter and send it out so we could get this lady on a flight soon and have her come home for her son. As soon as I put the last period on that letter, I was typing in the nurse's station. The kid coded just a few feet away. We couldn't bring him back. The next worst part, of course, was telling his father what had just happened and asking if he wanted us to stop the resuscitation. That conversation will stay with me. Story 7. Not a nurse, but a tech working on becoming a nurse. I've got a few stories. The saddest one was a woman who had an aggressive but treatable cancer. She was riddled with guilt from all the debt her family was incurring and broke down when she told me she wished she would just die soon so that the debt would stop accumulating. That one hurt to hear. And then the grossest thing I've had. In addition to the guy that was throwing poo at me every time I stepped in the room, I had a patient that was over 500 pounds. I had been told that she had a sacral wound and that during the night I would need to prep her for surgery in the morning. So the night is going on, everyone is crating themselves repeatedly, and I'm trying to keep up. Then I go to get this woman's bed prepped for the surgeon. I step in the room and this lady tells me that she's had a bowel movement. I did not need her to tell me. It looked like she was sitting in a tub of old congealed pudding. It leaked down the sides of the bed and had spilled out onto the floor. At this point, I backed out of the room and went to get some backup on this situation. So there's another tech and 4 nurses, for a total of 6 of us that were going to tackle this. Each of us had at least 3 contact gowns on, and we put on 2 masks with a layer of alcohol swabs and VapoRub in between them. Basically everything short of going in with full hazmat gear, but honestly, I wouldn't have turned down a nice Tyvek suit. So we step into the room and all get to cleaning the rancid swamp out of the room. And I mean cleaning it off of things that should never have had poo on them. So it's finally cleaned up to the point that we can actually approach the bed and get to work on the patient. We all position ourselves properly to roll her to the side, and it takes all of us to roll her. I happen to be on the ass-facing side for this, pushing her up. As we get her on her side, I see some gauze packed into her butt wound. Not unusual, but I knew it would be pretty gross. Problem was that the gauze had become one with the fecal material at this point, and so I basically had to reach in and start unpacking it with my hand. And it just kept going deeper. I was prepared for a nasty wound. I was not prepared to be elbow deep in it. And as I unpacked it, the smell of rot and feces began to hit, even through our defenses. One of the nurses stepped out and threw up into one of the vomit bags. So here I am, elbow deep inside a woman, cleaning the remnants of Lake Micrapgan off of her literal tailbone, and apparently accidentally snagged a couple sensitive spots because of the couple times she yelled out and smacked me in the head. Eventually, we managed to get the wound clean, packed it with fresh bandaging, and disinfected the whole bed, and finally she was ready for surgery. I had that smell trapped in my nose for a couple days afterwards. Just about all of us needed a few minutes to retch, and in some cases vomit a little after the whole ordeal. And then I got to go back to check in on my turd-throwing friend again. Story 8. I used to tech on a hospital psych ward. Our hospital had a small emergency room, but it's generally known that you bring psych admits there. I was outside on break one day when a woman pulled up to the ED entrance and asked for help with her boyfriend, who was drunk, volatile, and apparently want to pass. An ED tech came out to help coax her boyfriend out of the car. The boyfriend suddenly flew out of the car and cold junked the ED tech, broke his jaw. A police officer was just walking out of the ED after dropping off a different patient, saw what happened, and tased the boyfriend before he could attack anyone else. Boyfriend screamed and hit the ground hard. One of the taser prongs got him in the face. Boyfriend got the help he needed in jail. Story 9. I work in the PICU and it's a great job. I love what I do and it is awesome working with kids. They are a joy to work with. That being said, working in a critical care unit can have its emotional moment. The worst part of my job is hearing the cries of parents after the loss of a loved one. You never forget that. Good to have a good support system and stay physically active to get through those tough shifts. Story 10. CNA. Here, I once had a guy on a motorized wheelchair drive as fast as he could in the middle of the night. He ran into the handrail that goes along the hallway. He ended up with the rail going up his shirt sleeve and peeling back a good portion of the skin on his forearm. I had to hold a damp cloth on his arm until the nurse got the bandaging materials ready. The other aide I was working with started gagging at all of the blood and kept asking me how I could handle it. I had to keep her calm and keep talking to the resident to keep him calm. That was an interesting night. Story 11. CNA worst things you experience are the people you're not allowed to euthanize. The people who live in agonizing hell for decades, where you feel like a torturer when you're holding them down to let the nurse stick her 30-centimeter suction tube down their throat. I felt bad when I had to help force this man to stay alive. I wish I could take every euthanasia critic to show him/her the suffering some people go through because we force them to live. Life just is ducked up at times. Sometimes we're powerless and death is just the best option. Story 12. Not as impressive, but a lot of my patients have an altered mental status, and it's very common for them to rip/pull off all 26 wires we have glued to their scalp. Makes me cringe every single time. Story 13. Respiratory therapist here. When I was a student, we had to do a rotation through a NICU/PICU. The NICU was very busy with 7 or 8 sets of twins, all on mechanical ventilation. As the therapist I was with was giving me a generalized report on the babies and trying to teach me about the disease states the babies were experiencing, she said, "And mom only wants one of them," and moved on like it was nothing. I asked if it was common if a family only wanted one baby, and she said, "Oh yes, all the time. Sometimes it's because one baby is a lot worse than the other, and mom doesn't want to get too attached in case it doesn't make it, or like those two over there, mom can only afford one of them." I couldn't believe something like took place and was as commonplace as it was. Made me never want to work in PEDS. The human experience is far, far worse than the traumas and illnesses. Story 14. Diarrhea fountain. I was a third-year med student on my 3-month internal medicine rotation. For people who don't know, this is generally the time in your life where you feel the most stupid every minute of every day. I had arrived for work just barely on time at 4:30 a.m. for my 573-hour shift. Of course, I was dressed to the nines because medicine is stupid sometimes, and you have to dress to impress. Tie, nice escorts, slacks, button-up, that sort of thing. Might as well have had on tails and a top hat. Imagine a monocle for effect. I started rounding, of course. I went in to see Mr. Hippa. I had seen him for several days at this point, and he was usually pretty chipper. He had been in the ICU, but had done great and now stepped down to the floor. This morning, he wasn't talking very much. That's not unusual, though. It was 4:42 a.m., and I was barely conscious myself. But something felt off, and there was just an odor in the room. My spider sense was tingling, so I checked the bathroom. They always say you only have to smell Milena once to never forget. This was my once. The floor, the toilet, the walls were covered in that inky black-ass spray. I was assaulted by the pungent aroma of iron shavings and death. It was icky. So I went, "Oh, crap, mister. Hippa, I'll be right back." I toddled off to find one of my residents. Those lazy bums didn't usually wander in until after 5. Managed to find my chief, who seemed uninterested in what I had to say. I wasn't Chicken Little. I had never cried wolf before. I remember this seemed fairly important, and him showing no interest whatsoever. Bad resident, no donut. So I went to the real power on the floor, the nurse's station. They promptly did the wrong thing too. They check his BP and systolic is in the low 80s. Prior had always hovered in the 130/40s. My internal dialogue is screaming, that boy isn't right. But my third-year medical student body is standing there, now surrounded by multiple nurses, just trying not to get in the way and trying not to look even more stupid or say the wrong thing. Well, they want to move him to the chair. I still, all these years later, have no idea why. I managed to squeak out a, should we be standing him up right now given the crazy low BP and massive blood loss? But an MS3 speaking is like a fart in the wind, so I went unheard. So we stand him up. I'm holding onto his left arm, another nurse on his right. He had little strength to support himself. A half a gallon of blood-tinged crap promptly falls out onto the floor. I mean, it literally fell. Imagine moving your china cabinet and it tilts a little bit and the dishes just fall. It didn't squirt or spray. It just fell as a mass, hitting the floor and splashing out. At that point, Mr. HIPAA decides, enough with being conscious, and promptly passes the duck out. It could have been something to do with he now had a HGB around 3 and went from laying to standing with a BP on the lower end of life compatibility. Now I'm a regular-sized big guy, 6 feet 200 pounds. My nurse was 5 feet 3 120. Mr. HIPAA was 6 feet 3 250. There was no stopping this fall once it began. He fell face forward and planted right into his bed. Crisis averted. My moment of joy was instantly changed to terror as I looked down at his bare asshole, jackknifed into the air like a Whataburger A-frame. Then it happened. Diarrhea blood fountain. The perfect symmetry of it as it exploded from his ass is something I'll never forget. It was like the Bellagio or Buckingham Fountain in Chicago. Just this perfect fluid dynamic cone that reached 1.5 feet into the air, then gently allowed gravity to pull it down, making that gorgeous trumpet like flare. Except it was made of diarrhea and blood. Before I could think, suddenly Spy Break by the Propeller Heads was playing. For those not in the know, that was the song that played in the lobby scene in The Matrix. I, in my tie and fancy clothes, was Neo. My concrete pillars were the various nurses. They took hit after hit, while I dodged like Christian Bale in Equilibrium. I danced, I juked, I spun like no one has ever spun before. I was the Fred Astaire of crap swerving. When it was all said and done, 3 nurses lost their lives that day, meaning were covered in crap. While I, who had been staring down that fleshy barrel, had gotten away without one speck of red or brown or black on me. The outcome? Mr. HIPAA went back to the ICU, little bit of PRBC, another embolization, and he was home happy and healthy. 2 weeks later, I got in trouble for not letting my resident know what was going on. What? And as far as I'm aware, those nurses are still showering to this day. Story 15. Not really worst. Awkward, rather. Inserting a urinary catheter to a male patient, then after a few minutes, as you're about to insert the catheter, you noticed that their junk revived. My face turned red. I was 19 years old during that time, 4th year. My classmates teased me after that. Story 16. My mom used to work in a hospital. One night they had an emergency where a woman in labor had something go terribly wrong. There were medical staff rushing with bags of blood and taking them to the lab to rapidly conduct tests. It apparently was quite gruesome, and they were not able to save her. I'm not sure if the baby survived. Here's the worst part though. My mom knew the woman had passed and saw her husband sitting with their young son in the waiting room. I can't imagine that. And it messed my mom up a bit for a month. Story 17. I worked a temp job for a local hospital's home health/hospice department. One of my jobs was to call new patients and confirm their address before the nurse and/or therapist would make their first visit. I had to call this one patient who tried to take his own life. When I called, his uncle answered and went on a 20-minute rant about how worthless his nephew was and how he was a complete burden on the family now and that it would have been better if he passed. I understand death can be seen as a selfish act, but my heart went out to this guy. The patient obviously had some stuff going on to push to the point of attempting to end his life, and then for him to survive and have to listen to his family members say such harsh things. It was brutal to say the least. I often wonder what happened to him. Story 18. My story more emotional. My workstation was situated very close to the rooms where they would sometimes notify next of kin. The one that really stands out to me was an attempted carjacking gone very wrong. The person brought in was the suspect attempting the car. Jack and his potential victim hurt him. He passed away before the ambulance arrived. I don't know the exact age, but he was young. He was committing a crime and passing the attempt. I presume the person notified was the suspect's mother based on the sound that came from the room. It was like a scream, but there was an agonized mournfulness to it. Out of the things I've seen and experienced at the ER, that stood out to me more than anything else. Story 19. I was assisting in a delivery and had splash all over me. I got peed and pooped on too. We had to go house to house in a rural area And talk about birth control. This woman had 11 children. She got mad at us and kicked us out of her house. Found out one of the patients is pregnant for the 5th time because all other 4 were girls, and the mother-in-law has been forcing her to give her a grandson. That made me so mad. Story 20. Been around long enough to have stories. It's the ones that get through emotionally that are the most difficult. Had a patient come straight into PACU because she was so unstable, they could get her to the OR. Drunk driver hit her and she was losing blood so fast, we had buckets to catch most of it. The surgeon decided to keep her on the rapid infuser long enough for her family to get there and tell her goodbye. She was conscious the whole time. The goodbyes and the tears were almost too much for all of us. We turned off the infuser and watched the life slowly leave her. Story 21. I was an operating room nurse and I assisted a hemipelvectomy after a large vehicle hit a patient's whole left hip. Worst part is that it was a boy. Story 22. Had a patient in the labor room. Patient went to the bathroom and I heard her calling for someone. I went over and saw her crouching in pain. I tried to get her back to her bed, but she couldn't take a single step. She decided to lie down on the bathroom floor, and before I knew it, the fetus was out, lying on her gown. I felt so terrible for her, but at least she didn't have to suffer a long labor. Story 23. I'm a FF/paramedic, and that could apply to so many things. I work in a high crime level area, Dayton, Ohio. Honestly, though, I would have to say the worst thing is seeing the total apathy and lack of basic human compassion of so many people. They don't give a crap about anyone but themselves, call us pieces of crap, and are horrible to law enforcement, when most of them genuinely do mean well and want to help. It's not abnormal to be working an arrest in a McDonald's parking lot and have 10 to 15 people with their phones out. I say to myself a lot, I hate people more and more every shift. Don't get me wrong, I absolutely love my job. I work with the most amazing people. I still strive to treat everyone I come across with kindness, but I can't say the job hasn't changed me. Story 24. I'm a CNA for a nursing home. The worst thing I saw was a resident go through the dying process. I watched as her breath became longer in between each of them, and the rattling, and then she started to foam at the mouth. Then I watched as she took in her final breath and just stopped breathing, as if a switch was flipped. It was weird looking at the body. It didn't have any more life inside and just looked like a husk. One second it was a breathing, living thing, and another it was just a sack with no pulse. In Story 25. I work in a morgue currently on rotations and had a really sad case just a few days ago. Mom was young, went to the ER with abdominal pain and bleeding at around 30 plus 3 weeks, denied substances or alcohol use, and said she was taking her insulin accordingly, type 1 diabetic. But her blood sugar was 658. Mom came by and she admitted she stopped taking her insulin to lose weight while pregnant, was in severe ketoacidosis. Blood pH below 7 is considered fatal. She was at 7.01. She lost the baby. Story 26. I studied nursing for a while. There are a few things that have happened to me which were terrible. I was once assaulted in clinical by a patient that was an alcoholic that was drunk as hell. They somehow got alcohol when we let them out on pass to go have a cigarette, and detoxing from alcohol. This was seemingly out of nowhere. Story 27. Trauma anesthesiologist here. Once I had a 38-year-old guy come off his motorbike and get wedged under a moving van for 40 or 50 feet. He was dragged along until the driver worked out what was happening and stopped. Surprisingly did quite well, and everything was brought back up to normal location relatively intact. Second one was having in the emergency department. That scene will stay with me forever. He did amazingly well. We had a cardiothoracic team on standby in OR, waiting for a heart and lung transplant to come, so he went straight into theater and survived. Story 28. When my wife was a student nurse, she had hideous experience. One was a guy who had broken a tooth, but as he had a morbid fear of dentists and of anything to do with his mouth, he didn't seek any treatment for months, and the tooth got horribly infected. By the time he came to hospital, he was seriously ill and it was too late, and the infection got into his blood and he passed away a few days later of septicemia. Apparently, the smell from his mouth was the worst smell that any of the staff had ever experienced. Story 29. My sister's a paramedic. This one's sad, but it was the worst experience for her. She has a few sad stories, but the most traumatic to her, as being a mother of a child herself, fell out of a window. And even with all the effort put in to save him, the child didn't make it. My sister has cried over a few cases, but this one hit her the hardest. Worse was that an investigation went down because of the suspicion that it was no accident. Story 30. The worst thing I ever experienced as a respiratory therapist is being treated like an idiot. I had a nurse go behind my back to change a ventilator setting on a patient because he didn't like me. The patient ended up tanking and had to be put back on full support the following morning. I've had way too many situations where patient care was determined by someone doing something outside of their area of expertise instead of relying on me. One other situation was of a guy who had throat cancer. When we responded to his asystole alarm, the area around the bed was covered in blood. Story 31. Not in medicine, but there's a local hospital that recently had a patient brought in via ambulance that was completely responsive, nothing notably wrong. When left alone in the room and door closed, end his life right there in the ER. I imagine that this is something that will haunt these professionals the rest of their lives, and it bothers me to no end. Story 32, shoulder surgery patient who was getting ready to go home. Dressed in her own clothes, just waiting for her son to pick her up, smiling, laughing. Then there is screaming for the code cart. We hear a code blue in her room. She had slumped over, lifeless on the chair. We did CPR until the doctor called it. Her son witnessed the entire thing. We had a moment of silence, and standing with 10 hospital staff in the room surrounding this woman, the son said stoically. She was a great mom. She lived a good life. And everyone in the room began crying. She died from a saddle. PE. That happened in the first hour of my shift. Something about how composed her son was, and how everything ended so suddenly numbed me. I've had many deaths working in the hospital, but this one stuck with me. Story 33. Not my story, but my mom's. Out of all ducked-up crap she witnessed as a coroner and as a nurse, this takes the first spot. It happened a few years ago, and it feels like it was yesterday. As usual for that time of year, there were more died cases, and I got the phone call in the morning. She woke me up. It went like this. Hey, so I was out this evening on a case, and I've been to your friend's house. At which point I was like, oh crap. Must be her grandpa or something. Better call her up after this call ends. She continued, she end her life? I found her. I'm so sorry. My friend was 18 at the time. She suffered from manic depression for a while, and her mom didn't do anything to make it easier. It sucked for me. I can only imagine how sad it was for my mom to see someone my age passed away, especially since I suffered from depression at the time as well. Story 34. The night shift. I was the ward on-call doctor for a hospital, and in the space of half hour I was contacted about a man unable to breathe and likely needing initiation of a BiPAP machine, another guy with chest pain, a lady in screaming delirium, keeping the whole CCU awake, someone else seizing, a man probably in septic shock. The doctors doing the take, admitting patients, were short, and so snowed under, they had asked me to help earlier in the evening. Even the surgeons were in theater with an emergency. Some of the nurses were helpful, but unfortunately it seemed like most the less useful ones in the area were on shift. I just had to triage and fix what I could, but every time I solved one thing, something else went up crap creek. The only break I had for around 10 hours was about 4 a.m. I started crying when I sat down to prescribe something or other, and a lovely nurse brought me a biscuit. No one died, but it wasn't for lack of them trying. Also, I remember vividly the next shift I worked a couple days later because a patient's wife shouted at me for taking 2 attempts to get blood from her very obese and edematous husband. You should be ashamed, she said right in my face. You're only hurting your patients. Why are you even a doctor? Not for the feel-good factor, clearly, Karen. Story 35. I received a call from the ICU for a stat ECG. I got there in less than a minute. As I entered the room, there were a lot of people standing by the patient's bed. Turned out they just signed that DNR form. So I just spent the next 30 minutes watching this man slowly pass. It was traumatizing. His whole family saying goodbye and crying around his bed while I stood there the whole time. Story 36. People refusing medicine for their children. I get if it's you because it's your decision. If it's a child, then you are putting someone else's life at risk. I have no problem with people using essential oils if they actually get proper treatment. Some kid had a wound on his foot and his parents put vodka on it, which causes harm to healthy tissue and can harm more than it helps. Kid got an infection and almost lost his foot. Story 37. Not a nurse, but I'm a maintenance man at a smallish rural hospital. I've gotten all kinds of weird calls. One day we had a guy come into the ER with a very large pole barn nail. The doctor asked me to cut the head off the nail so she could pull it out. We discussed several options and determined that a Dremel would be the best option. So they wrapped up his arm, and I cut the head off the nail while they held some sort of medical vacuum to help collect the dust. That guy was a tough old bastard and just sat there while it happened. Story 38. I am an MD in charge of a research study involving terminal patients. The worst was a young 40s patient who had just found out he was terminal and still had some form of hope. A colleague made the comment that we aren't trying to cure anyone or even prolong their lives. At this point, it's just sorting out what is safe. I don't know how this dude had gotten to this point not knowing, or at least not facing this fact, but he was absolutely destroyed. Stays with me. Story 39, obligatory, not a doctor, but I once accidentally somersaulted through a window and obtained a 3 or 4 centimeter deep laceration in my lower back, nearly touching my spine. And oh boy. When I got to the hospital and a few of the nurses were freaking out, it was pretty funny. When I woke up from surgery and remembered it, doctors and surgeons have read it. Have you had any, oh crap moments while working? If so, how did you respond to it? Story 1, former Detroit EMS paramedic here. So many to tell, but this one will stick with me forever. Rainy afternoon in the spring. The call for was a drunk person, randomly pounding on house doors. Normally would be a police response, but they were swamped, and the alcohol gave it a medical component. Whatever. We pull up to the house. No lights, no siren. Hell, I'm so burnt out at the time I don't even get out of the passenger seat. I just power the window down. "Hey!" I snap at the older gentleman on the porch. "What the duck are you doing?" He turns from pounding at the stranger's door and begins shuffling down the walkway toward our ambulance. I can see the elderly woman close the curtain, her nuisance addressed. "Man, I just gotta lay down." The drunk slurs, his sour, ETOH breath making my eyes water. I look at my partner and she at I. Henry Ford Hospital is 6 blocks away. Surely we can dump the stank bastard there. "Get in the back," I snap at him. "And if you puke in my bus, I'll mop it up with your clothes." "But I got the chest pain," he says, holding his third-hand London fog closed against the pelting rain. I roll my eyes. "Man, I do too. So let's go to Ford's and both get checked." The drunk begins fiddling with his button, and I reach over from my seat to dial up the heater. When I look back, he's got his trench coat open to show me exactly where it hurts. Right in the middle of his sternum, vividly defined against his white sweatshirt, is a star-shaped powder burn. A big one. Crap. The next 4 or so minutes were a blur. Rushing out the door to grab the man as he was about to fall. My partner yanking the stretcher out, loading the patient and loading him in the back. Scissors cutting clothes, oxygen mask going on. Yelling, "Go, go, go," to my partner as she raced the 6 blocks to the hospital. I really only managed to get 1 IV started during the 3-minute ride. He was dead 25 minutes later. When we rolled him in the trauma room, you could see an exit wound the size of a fist. The doctors assured us that the only thing that could have helped this man was if he fell into the OR after being shot. But that didn't bring me any peace. We probably spent 10 minutes talking to the man as he stood in the rain. For me, that was my out cue. I took a week off work and resigned 2 weeks later. Story 2. My friend was on rotations and he was suturing a woman's, after she gave birth. He said he botched it up so much that the supervising surgeon laughed a little and had to take over. I asked him what it looked like when he did it. Like the edges of a Chinese dumpling. Couldn't eat dumplings for a bit after that. Story 3. My father is an ER doctor. Old woman comes in with a headache. Attending sees her, sends her home with some Advil. You can tell where this is going. She comes back 2 days later with a stroke and chest pain. It is a massive stroke, so they get her on blood thinners right away. They send her in for a CAT scan to check out her brain. Basically just neck and head. On the scan, they notice something odd. Do another scan. Her aorta has almost completely dissected. This is the most blood-filled, high-pressure artery in the body, and blood thinners are the absolute last thing that an aortic dissection patient should be given. Commence freakout. They wheel her into emergency surgery to repair the aorta, but by then she's bleeding into her pericardium. Her heart stops shortly thereafter. Luckily, my father never personally prescribed the blood thinners, but apparently that was a real, oh crap moment. Her condition was fatal either way, but it was not a good day. Story 4. Non-doc/paramedic story, but a good one from in the ER. I was in 6th grade and my family was living in an upstairs/downstairs duplex. The family above us had 2 small boys, 1st grade and preschool if memory serves. Their dad was at work and their mom had to run some errands, so she asked if I could watch them while she was away for a while. It was a nice summer day, so we were outside running around in the yard, generally acting like kids. A game of tag or something soon developed, with the 2 boys chasing me. At some point, I ended up running right along the side of the house and losing my footing. Down I went. But the ouch factor was much, much too high, and not in the accustomed place to a fall. Instead of my knees or my palms, it was the side of my head. It hurt. I got to my knees and put my hand to the side of my head, only to feel warm liquid. Lots of it. I looked at my hand and it was like it had been used as a prop from the movie Carrie. I looked up to see a nice little trail of blood on the wall of the house, leading up to the head of a nail that was sticking out about an inch. My dad grew hollyhocks and would tie them up with twine so they wouldn't fall over, and I had just enough unluck to catch one right over my eyebrow. So I went inside and informed my mother in very precise terms that I was probably in need of medical attention. My history with emergency medicine is pretty robust, so my mom is quite used to the sight of me coming into the kitchen broken, so very little fuss was made, other than a frantic towel-grabbing mission before packing me and those 2 now very scared little boys into the car and heading to the local ER. This is where the oh crap moment happens. Remember, this is a weekday during the summer in a suburban neighborhood. The ER was completely empty, except for the receptionist typing away at something. Mom lets me out to start admission while she parks the car. Apparently my arrival went unnoticed, because the receptionist didn't look up until I was just a few steps away. I smiled weakly and said something to the effect of, "I think this needs to get looked at," while pulling away the now very blood-soaked towel. At that moment, A small arteriole decided it had had enough and proceeded to burst forth. Needless to say, I was making a right mess of the place. The receptionist calmly responded by fainting. I have no idea how one becomes a receptionist at an ER. Even one as relatively calm as Providence Milwaukee Hospital, while having issues with blood, but somehow this poor woman did. So now I was standing there in that antiseptic white reception room, bleeding quietly to myself, with an unconscious receptionist behind the counter, and my mom out in the parking lot still dealing with two panicky little kids. I had a major oh crap right then and there. Fortunately, at that point, someone else of better intestinal fortitude came out and saw what was going on and got me rushed back into an exam room, along with the woman who was apparently spending time with the penguins. I got 32 stitches and now the scar is barely visible as that minor line right above my eyebrow. Story 5. Sure, I'm a doctor. One time when I was a teenager, my grandma caught me pleasure and I remember being like, oh crap. I responded to it by crying for the next 5 hours. Story 6. I work in an OR. And this kind of stuff happens all the time. In the hands of a skilled surgeon, those oh crap moments are dealt with quickly, and the surgery continues on as if nothing happened. And if it won't affect the patient's recovery or quality of life, the event usually stays in the OR. Story 7. My mom is an ER surgeon. About 3 years ago, a car crash victim came in real early to the emergency room. He had a wooden block logged in the side of his head, and the windshield shattered all over his face and neck. My mom saw him and was immediately determining how to fix him up, and she decided to start with the wood. Her oh crap moment came when she saw the wood was in the throat. Unfortunately, the man passed away a couple hours later, but my mom did her best to try and remove the wood, but the damage had already been done. Story 8. Not a doctor, but I do have a fun story. I have a CHD, and I once watched a video of my surgery, as they are used as teaching tools at Baylor, and I convinced someone to let me see. At one point, the surgeon says, "Oops." I couldn't pick out the mistake, but it certainly freaked me out. Story 9. As an ultrasonographer, I have oh crap moments every day, where the patient has RCC or a missing heart rate, even code brown. But the biggest oh crap encounter was a young man for scrotal ultrasound. He had a history of testes CA and had one removed. The other turned up with an internal mass. His parents were not pleased with the news. Story 10. My dad is a doctor. He once had a woman who came into his office and was complaining of feeling ill and having a lot of discharge. So, of course, she asked for an examination. During the examination, my dad smelled disgustingly foul odor and had to remove an old tampon. After pulling out the tampon, he could still feel another mass inside with the speculum. Then, having to endure the ghastly smell for longer, he realized there was another tampon. She apparently had forgotten she put in a tampon and then proceeded to put another one in. Story 11. My dad said he was once using surgical glue on a patient on a chainsaw accident. On accident, he glued his glove to the patient's stomach. He said he laughed for a bit, then apologized when he left to get solution to remove the glove. Story 12. I had a hernia as a kid and the dude removed the wrong thing. Apparently he said, oops, and then finished what he was supposed to be doing. We aren't totally sure if I'll be able to have kids now. Story 13. Femur fractures are sometimes treated with a rod that goes down the inside of the bone, termed an intramedullary nail. The rod is then locked into place with screws at the top and bottom of the rod. The screws are drilled through the bone, into the rod, and out the other side of the bone. Routine surgery for an orthopedic surgeon. Sometimes the rod has to be removed, as was the case for Mrs. Smith. To remove the rod, an incision is made down to the very top of the rod. A special handle is screwed into the top so that a hammer can be used to backslap the rod out. Before removing the rod, however, all the screws have to be taken out first, obviously. Except they weren't. It turned out that Mrs. Smith's rod was a little harder to remove than normal. It took quite a bit of force hammering that rod extraction device. Slowly, bit by bit, blow by blow, the rod was removed from Mrs. Smith's femur. When it was about halfway out, it should have just slipped on out, but it wouldn't. So it was decided to check things out under x-ray. That was the oh crap moment. The screws at the end of the rod had been dragged up through the bone with every hit. The femur had been split down the middle. Words were said, gestures were made. The screws and rod were removed. Everything was fixed. When she finally awoke from surgery, it was realized she was about 500 feet tall and from the Paleolithic era. She went on to sue the surgeon, the implant manufacturer, and the hospital for $3.50 apiece, all of whom vehemently refused to pay. Story 14. When I was in residency, my first solo procedure was a spinal surgery. And at the end, after 13 hours, I was closing her up and I accidentally hit her dural sac. And the terror was just so crazy, so real. And I knew I had to deal with it. So I just made a choice. I'd let the fear in, let it take over, let it do its thing, but only for 5 seconds. That's all I was going to give it. So I started to count. 1, 2, 3, 4, 5. Then it was gone. I went back to work, sewed her up, and she was fine. Story 15. I'm no doctor, but I've preformed surgeries on rats for the last 2 years. our lab researches epilepsy. So as part of my team, we had to be teacher's assistants. One of the neuroscience labs required that the students perform a brain surgery on a rat. But before then, they had to see us demonstrate it. During the demonstration, one of the students went ghost white after seeing the skull drilling and fainted, fell flat on her face. She broke her nose as well as 5 of her teeth. Story 16. I was working in the trauma unit one morning when I got an emergent EMS call over the radio about somebody with arterial neck bleed from an unknown injury. Prior to arrival, I called down the surgeons and we all gowned up in full PPE and were waiting for him in the critical bay. So in rolls this old guy with a 4x4 of gauze on his neck just sitting there, and EMS just rolling him in on a gurney, clearly in no distress. So we're assessing the guy and looking him over, half of the surgeons looking at me, trying to figure out why I called them down. I remove the gauze, nothing obvious, maybe a small dot of blood, but really nothing. So all of us are leaning in to get a better look, and all of a sudden, one super thin stream of blood streaks out of this guy's neck all the way across the room and hits the wall. All of us jumped back and half of us screamed. We all stood there, looking at each other for a second, before we all started laughing. Apparently, this guy had been picking at something on his neck and hit a superficial arterial vessel. Scared the crap out of me. Story 17. My mom, a pediatrician, had a moment like that, but it was also interspersed with motherly panic. My older sister was around 5 or 6 at the time. She was running around the house as normal, and then she tripped. She fell chin down. So we all had to rush to my mom's office late at night to get her some stitches to close the gaping hole in her face. She still has a faint scar there. Story 18. My dad was observing a surgery during his residency several decades ago when electronic monitors were becoming a huge deal. He noticed the patient's fingertips and lips were blue and tried to tell the surgeon, who informed him the patient was fine because the machines showed normal oxygen and blood pressure. Dad responded by jumping in top of the patient and performing CPR while someone had the common sense to rush them to the ER. Best part is that a representative from the company that made the machines was there to observe this miserable failure. Story 19. Surgical resident here at a quaternary care center, very large central medical center, where all the patients other hospitals can't handle are sent at all hours, and I mean every possible hour. I have been paged at 3 a.m. that my patient on 3 pressors and an open abdomen just arrived. What would you like to do? I've been called in the middle of the night for bleeding that turned out to be nothing and turned out to be a bedside laparotomy. Oh crap moments are a dime a dozen. You quickly adapt from your intern year from a reaction of sheer terror to a systematic approach to ID and fix the problem. Start with ABCs, airway, breathing, circulation, then identifying the cause as quickly as possible, the most appropriate steps for further workup versus intervention. It becomes second nature. Sure, your stomach may drop if you forgot something and it's your fault that crap happened, but in most other situations, your training kicks in and you simply begin to work. When you are out of your depth, that's when panic sets in. The most common one is bleeding intra-op. You don't even flinch unless it's from the aorta or other major vessels. Even with big vessels, it's relatively simple. Gain proximal and distal control. Loop rubber strings around the injury to isolate the area and close. It's routine. When it's unexpected and hard to control, that's when crap happens, trauma, mistake, etc. But the steps are the same. But over the course of your training, especially at a place where all the crap gets shipped, you will see and handle damn near everything. That being said, it actually has had a secondary effect on my outside work life, where the volume is turned down on everything else, almost to a negative state. When you answer hundreds of pages a day and your brain is constantly and furiously triaging the bad, the ugly, and the outright horrifying, the rest of the world is almost white noise sometimes. Other problems seem less serious, even though in regards to the situation, they very well might not be. It has led to issues where I seem almost apathetic in my response to outside issues, which can lead to problems with the people around me. Story 20. Not a doctor, but my dad's doc had his oh crap moment during surgery on his spine. My dad had to have surgery on his spine because one of the vertebrae had shifted and was putting pressure on his spinal cord, and had been that way for a long time. The doc actually said once he got the MRI, to be honest, I'm amazed you're still walking. The cord is actually pinched, and one wrong move could cause it to be severed. It was in his upper back. Surgery goes on. My dad is nervous because he's never been through any major surgery, and they must use a particular mix of anesthesia because his body must be awake enough that it is sending electric signals through the spine appropriately. But asleep enough, he is out for the pain, cutting and chipping away at the calcification of bone on his spinal. Then would send electric impulses through his spine to the rest of his body, and had it all monitored by an entirely different team of doctors to ensure that while they were working on his spine, no part of the body lost connectivity, got paralyzed. In recovery, he wakes up and is completely coherent. 2 doctors are outside his room discussing the surgery, and meanwhile, He's a little freaked because he can't really move his legs. He hears one doc tell the other, "Yeah, did you see during surgery? We lost his legs for a few minutes, then for no understandable reason, they just came back." He said he about lost his crap at that point. He's fine now and is back to normal, but now he no longer suffers from burning/numb legs and burning/numbness in his chest, and can lift his leg to a normal height again. Before, he had trouble even walking up a step because of the pinching on his spinal cord. Story 21. My dad had a triple bypass in 2011, and right when they were about to close him up, the vent fell out of the ducting ceiling, contaminating everything. My dad looked like a Smurf when he finally came out of surgery. They disinfected him so much. The surgeon was an ex-army surgeon, and he came out pissed. He basically told us that if my dad suffered any sort of post-op infection, we would own the hospital. Luckily, my dad was just fine and is still with us, healthier than he has been in a while. From what we have heard, the maintenance crew was epically chewed out, and the story is still told at the hospital. Story 22. I'm a junior medical student, and I had an oh-so-big crap moment. I was on a placement, and we were looking after old people at the rest home, just to get an idea of how things work there, and more to understand the residents' perspective of things. I got placed in the psychogeriatric ward, the people with the worst dementia and a psychosis. Anyway, there was this one guy, let's call him Tom. Tom had no family, and he was in a world of his own where I'm pretty sure most of his stories were made up. The one he told me every time was how he used to sleep with 3 ladies at Leets once a week in his youth. The last time I was with Tom, he was telling me this story as I smelt the most horrific smell. He did a crap in his pants, and I mean the most massive, explosive crap I have ever seen, and had gone down his pants and was already leaking onto the floor. I go to get one of the nurses, literally thinking, oh crap, oh crap. When I come back with one of the nurses, we find Tom smearing his crap all over the walls and toilets, still talking about the gals he used to get. If only they could see him now. Story 23. My grandfather would tell me that when he was starting as a surgeon, him and his colleagues would play prolific amounts of golf. It was so vital to play this golf that if the surgery was going too long, then would stuff the patient, sew them up and leave them on anesthetic, and head off to play 2. All this so that they would not miss their tee-offs. They did come back and finish the surgery, though, once they did their 2 rounds. Story 24. I'm not a doctor, but I was the patient in this oh crap moment. I was in 6th grade and bouncing a golf ball after recently discovering that golf balls are extremely bouncy. I began bouncing them harder and harder until it was going about 30 to 45 feet in the air. I was about to go inside when I had a great idea: bounce it as hard as I can. Something I hadn't noticed before I bounced was a small pebble, no more than a centimeter in size. Well, the ball hit it, and like a boomerang at 40 miles per hour, returned to my face, specifically my eye socket. So, like any rational kid, I screamed. About 20 minutes later, my mom arrived and took me to the hospital. As I got there, the lobby was extremely busy. That didn't matter to the emergency team, considering there was so much swelling on an 11-year-old child's face that they couldn't tell if I lost my eye or not. They gave me priority access to the emergency room. So I go back to the room, face all bloodied and swollen, to see the ER doctor. I'm sitting in the medical room waiting for 10 minutes when he walks in. He sees me, drops everything, including tablet, clipboard, and thermometer, and calls in 2 more staff. They cleaned my eye up pretty well, got rid of all the blood and crap. Swelling was still horrible though. They then started to explore the wound. To my great discomfort, the doctor sticks his gloved finger into my wound, only to realize his finger came out. Another place. This was when he said, crap. Because of the region of the injury, the doctor couldn't use stitches, so instead opted to use medical glue. So in about 4 hours, he had me pretty patched up, and I was just about ready to go. Somehow, my eye itself had actually been able to stay together, no injury to my sight. But now, I have a scar, all because of me being an idiot with a golf ball. Doctors on Reddit. What is the most obvious lie a patient has ever told you? Story 1. Paramedic responding to a man unresponsive on the street. Pinpoint pupils with a syringe hanging out of his arm. Narcan administration wakes him up like magic. I don't do substances. Story 2. Was a provider in a rural area. Urgent care. Guy and girl come in complaining of bug bites. They are covered in open sores. They deny substances use on social history. I ask, do you use illicit substances? Denied. Okay, tactic changed. Listen, I don't call the cops on people who use. Can we start over? Them met. You don't say. Story 3. You can see she wrote doses on my substances sheet. 600 milliliters of met. The addict and hospital regular shouted at me. I look at the substances card. I can see where the pharmacist has written it down in standard green pen, except for the last 0 of each dose, which was written in a slightly different shade of green pen. Bravo, sir. Story 4. Not sure if this counts, but while taking a new patient's history back in 2011, he told me he was in a band. I told him I was a musician as well. He got all excited and started to talk more about the others in his band. They were none other than the Beatles. He spoke of all of them in present tense too. It was a sobering moment. I never would have known he was schizophrenic if I hadn't asked him about his hobbies. Not up until that point, anyway. Story 5. My roommate from college works some hours in the ER, and people still come in all the time, claiming they slipped and fell asshole first on insert object. You can literally order toys online and have them shipped directly to you with no one knowing. There's no reason to keep sticking household items up there when we have so many things specifically designed to go inside. Story 6. Nurse here. But I had a patient who claimed he had seizures. When he was having a seizure, I went, I don't know what give him to stop it. And the patient replied, substances, while shaking. Story 7. Worked for a substances research clinic. We told guys a blood test will be done. If you have any illegal substances, they will show up. Don't waste your time. If you have used this, just come back in a week and be clean. No penalty, no judgment. You just need to be clear of substances for a week. A full 75% swore no substances, yet the test results showed that was a lie. Story 8. Not my case, but my mother's. We work together. We're both dentists. She starts extracting a tooth of an elderly lady after thoroughly going through what medication she takes, any chronic conditions, etc. She asks her if she takes any anticoagulants, blood no stop if taken. Nope, she doesn't take any. Any aspirin? Nope, no aspirin. So my mom extracts the tooth and now the wound won't stop bleeding. My mom asks again about anticoagulants specifically. After 30 more minutes of this and an x-ray to check if there were any root fragments left in the socket, the patient, now distressed that she still won't stop bleeding, says something along the lines of, maybe I shouldn't have taken insert anticoagulant brand name here this morning. Story 9. Not a doctor, but a medical assistant. My blood pressure isn't normally that high. My patient is panicking after seeing the numbers and swears up and down that the high BP is wildly abnormal and incredibly worrying. I don't see any filled BP med prescriptions on their chart. I run the machine again, I get a manual BP, I get the nurse involved. We start checking in depth for symptoms of a hypertensive crisis. We involve the doctor in case the patient needs to be admitted. And 15 minutes later, the patient comes out with, well, I guess I haven't taken my blood pressure medication at all in the past week. Could that be affecting it? They were under the impression that being prescribed the medication would immediately change their blood pressure even before they actually started taking the medication. I've started asking about meds right away to head off the panicking when the BP comes back high, as it almost always does in our clinic. Story 10. I didn't drink. Sir, your blood alcohol level would kill a normal man, and I can smell you from across the department. Also, you fell over twice trying to stand up. Story 11. NAD, but I work it in a hospital. I had a ticket to replace a keyboard in an ER and got chewed out by a doctor for response time. I was actually as prompt as possible for my part. As I was working, I overhear the same doctor was making small talk boasting about this and that. When a nurse came in and explained some test results for a patient the doctor had, which proved that the patient wasn't lying about being sober and actually having some concerning results. The doctor laughed about it and said he assumed they were lying and drunk because they were so sloppy. And it was not said in a funny way, but a demeaning way. All I could think about was how much I hated that if I were that patient, I would hope the doctor would believe me when I said I didn't drink, but that my seeming drunkenness was worrying symptom. It scared me a bit. Story 12. The doctors I work with will ask if patients are taking their medication. They say yes. And once they're under anesthesia, the doctor says they never filled the prescription. Story 13. Back when I was a med student, I was on an ER rotation with this older guy who came in and claimed to be having serious abdominal pain. Barely touching his stomach would send him into a screaming rage of pain. The attending asked him to stand up. He gets out of the bed and acts like he's in severe pain. The attending asked him to jump, so he starts jumping up and down. Then the attending looked at me and asked, "You ever see someone with an acute abdomen be able to jump?" So yeah, this guy was a known pain pill seeker. I'm sure I have more, but immediately thought of that one. Story 14, MGI. I was at the pub having lunch, and next to me was a guy 5 or 6 pints deep. I vouched for a sour ale he seemed unsure about. He ordered it, still drinking it when I shook his hand and left. Afternoon, I walk into my exam room, and that guy is sitting there. Me. "Oh, hey, Chief, I met you at an X pub earlier." PT. "Wasn't me. Me. I told you X drink was great. You ordered it, but that wasn't me. Found it odd, but skimmed the chart a bit. We don't get to do it beforehand sometimes. And figured out quickly why he was lying. Referred to our hepatologist for evaluation and management of his alcoholic cirrhosis. Office scheduled him with me accidentally. Had indicated to the rooming nurse that he was sober for 6 months. I apologized for the scheduling mix-up, but warned him it was a bit pointless to lie about his alcohol intake. He still lied at his rescheduled appointment with the correct provider. Oh well, it's his liver, not mine. Story 15. I never smoked like ever in my life, and you're sure they smoked a cigarette literally like 10 minutes before you came, because they smell like an ashtray and they have really, really bad PVD. Story 16. I am a medical laboratory scientist. I am the guy who plays with all the stuff your mother told you never to touch. One day, a labor and delivery patient drops in and decides to have her baby. She had no prenatal care. The nurse draws her blood and sends it to the lab. I do a type and screen, blood type, and RH. We do this on all patients because lab people are paranoid. Patient tests as a positive. In the computer, her history shows B positive. I send the phlebotomist to draw her blood because lab people are paranoid. Still a positive. I dive into the history and, yep, 2 years previously, I was the one who typed her as B positive. This time, I draw her blood because lab people are paranoid and let the nurses know there's a blood bank discrepancy. Call the physician. We can't give her type-specific blood if she needs it. We will have to give her O negative and start an investigation. Blood types don't change except for very rare circumstance. As I'm retyping her for the third time, still a positive, the nurse calls me, laughing. Our mama-to-be was admitted under her sister's name. She had stolen her sister's Medicaid card instead of getting one of her own. She didn't want her folks to know she was pregnant. Story 17. I'm not a doctor, but a friend of mine works in an ER in Mormonville, Utah. Weirdly, per his stories, a lot of 110% heterosexual men will walk through their kitchen with no pants, slip on accident, and fall onto a cucumber. It's really weird. I'm not sure how cucumber accidents keep happening to definitely straight men with wives and kids. Jokes aside, there is nothing wrong with gay or bi, and nothing wrong with being a straight man who likes toys. Story 18. Not a doctor, but I imagine any doctor who works in a clinic that treats STDs has had a lot of married men claim to have gotten an STD from a public restroom toilet seat. Story 19. Your skin is really dry today. I'm worried that's what's contributing to your itchy skin. What lotion do you use? Oh, I use this brand. I just didn't put it on today, as I try not to breathe in the snow of dry skin flaking off my patient's legs. Seriously, y'all. Regular lotion use will save your skin. I can't tell you how many patients I see daily for an itchy rash on the legs due to dry skin. Story 20. I've had a lot of pain that has landed me in the ER. I've been treated horribly at times. It's crazy when I tell them that intravenous Toradol normally helps a lot if I haven't had it recently. Toradol is a Medix. I've never felt a mental effect other than relief from it. Works like an instant anti-inflammatory and just eases the pain significantly. I've had doctors scream that I was substances seeking and they weren't going to give me anything changed to, oh sure, when I mentioned Toradol. Story 21, Spanish-speaking patient tested positive for MET on his urine screen. When I questioned him about it using a translator, patient proceeded to ask me whether it was some sort of multivitamin. Story 22, patient in with endocarditis had PICC line, found in the bathroom with an empty syringe and a substances baggie. Room searched and multiple syringes and substances baggies found. Started crying, why would my boyfriend bring this in? He knows I don't use it. I didn't use it. Story 23, I had a guy who had a lymphoma, came in not feeling well. His liver enzymes were trash. He looked like death. He was tachycardic and his blood pressures were very borderline. He kept telling me he felt fine and would be fine going home. We spent all day on the phone back and forth with oncology and infectious disease, and the worry was that his lymphoma had transformed to a more aggressive type. Overnight, his blood pressure tanked, and he went to the ICU. For my medical people, his overnight lactate was 12. He wouldn't let the overnight resident call his family because he was fine. He died the next day. Very, very sad case. If a doctor asks to call your loved ones because they're worried about how sick you are, believe them. Story 24. Me. Do you smoke? Patient. No. Me. But you're left-handed, yeah? Patient. How did you know that? Miss, you have tar stains on the fingers of your left hand. Story 25. I'm a nurse, not a doctor, but I once popped my head out from behind a wall and startled a man who was clearly trying to pump hand sanitizer into a cup of water I had given him 5 minutes prior. In his state of panic, he instead pumped hand cream into it, mixed up the dispensers, and then told me he was just looking for some more water. Sure, bud. Story 26. My cousin is a doctor. He said a very obviously pregnant girl came in with her mom. She was 5 to 6 months along. When asked if she ever had sexual contact, she said no. Her stomach looked like she was pregnant. Doctors have a list of questions they need to ask to be sure about diagnosis, like, are you sexually active? To rule out other disorders and tumors. This is only funny because they sent her in for an ultrasound and saw a baby. Story 27. Dentist here. The man that owns the nail salon across the parking lot is my patient. Every 6 months, I ask him if he smokes cigarettes. Every visit, he denies it. And yet, every day I watch him from my office, smoking a pack of cigarettes. Sometimes I wave Story 28. Can I chime in but reverse? I had just had a baby and was recovering in hospital, and when Bubs cried, she would do this really high-pitched scream. I'd get random nurses and doctors come in throughout the day asking me if I smoked or had alcohol much while pregnant, or if I drank too much coffee. Asking how was I feeling, checking my vitals, really random questions. Finally, a midwife came in, and lo and behold, she was my childhood friend's mother. We had a chat, she cuddled my baby, she heard Bubs scream cry and looked at my chart and laughed. She told me, babies with such a high-pitched scream are normally the ones suffering withdrawals. They thought I was a user of something Story 29. There are way too many to count or even to really remember. People lie constantly. Guy told me he had never had surgery. On exam, had a clear midline laparotomy scar, big surgical scar on the abdomen. Then he told me he'd had liver cancer, and the scar was from that, so I looked up the records from the hospital where he had told me he'd had that surgery. The surgery had been for removal of a shampoo bottle. We were in a city with many hospitals, so I have no idea why he told me to check the records, the actual place he had gone for the shampoo bottle surgery. Story 30, I once lied to the paramedics because I really didn't want to go to hospital. They asked if my pupils are usually different sizes, and I said yes in the hope they'd say, oh, never mind then, bye. Anyway, they absolutely did not believe me and took me in to be checked for a stroke. What I was actually having was a hemiplegic migraine. Story 31. Pregnant woman squatted on the floor in front of me. Peed on the floor, stood up, and told me her waters had just broken. No? You just peed on the floor? Story 32. My sibling is a doctor and told me of a time a girl was very obviously faking seizures, and when another doctor said she was faking it, she stopped mid-seizure and said, no, I'm not. Story 33. A cousin had an itch, and it seemed right to put Listerine in a syringe and introduce it inside. Then she had to go to the doctor and tell him that all her discomfort was okay, but she never mentioned the Listerine to her, and she spent months in treatment because the doctor told her that she had a burn on her cervix, and that worried her until after maybe 6 months she confessed what she did, and the doctor changed her treatment, and she improved in days. Nowadays she tells it and she laughs because the doctor was more worried than her. Story 34. Not a doctor, but a nurse of 20 plus years. If a person is lying to you, I absolutely let them and am unbothered because they're telling me what they want me to know about themselves. If there is a lab or test result, I need to base my care around the result. I rely on that result to give me the information to safely care for that person. If the result returned is the opposite of what a person is telling me, I know there is a deep shame, medical-based stigma, or defense mechanism in place for the person receiving care. Medical settings are not safe spaces for everyone. Let people lie. They're going to do it anyway to protect themselves. It often tells you what you need to know, and there is never a reason to shame anyone seeking care. Story 35. Not a doctor, but a former vet tech. The number of people who would swear to me up and down that they don't do substances, and there is zero chance their dog could get them, while their dog is obviously high. Well, we do have this potpourri. Listen, for one, no one wants a pot-scented air freshener. 2, I don't give a crap. I just need you to tell me what it was so we can treat your pet. 3, maybe ease back on the substances so you stop leaving it where your dog have access to it. Story 36. I was just standing on the corner, minding my own business, when someone drove by and blew white stuff in my face. That's why I tested positive for substance. Story 37. My anesthesiologist sister routinely has patients claim to be allergic to every single medics, except Dilaudid, or whatever the substances of choice is, but it's usually Dilaudid. They regret it though. As she explains to them, it's extremely rare to be allergic to certain narcotics. So, since the patient is already allergic to so many of them, Dilaudid will probably cause them to go into anaphylaxis the very next time they take it. Safest to do no substances, ever. They will have to do their surgery on Tylenol. For post-surgery pain control, Tylenol. She'll put a note in their charts and talk to their doctors about how they can never ever safely take any substances again, regardless of pain levels, because of their allergies. The thing is, everything she is saying is true. If they are allergic to half a dozen substances, they can't safely take any narcotics. Their clinic doctors, who they hound for Dilaudid on the regular, usually respond to SIS along the lines of, bless you. Now they have a documented medical reason to say no every time without exception forever. Take a Tylenol. Don't lie about medication allergies. Story 38. Me. Do you have hypertension? Patient. I don't have hypertension. Me. Do you take any medications? Patient. I'm taking losartan, lowest dose daily. I have a low blood pressure already. Story 39. My dad told the doctor with a straight face that he loves walking, and he walks daily despite actually being bedridden for the past few months, and when he could actually stand, just sits on the couch to watch TV. I understand lying, but not something so blatantly untrue and easily verifiable. Story 40. Farm tech here. I take that every day. Karen, please. We haven't filled that prescription in 6 months, and it was a 1-month supply. Don't lie to your pharmacy. Trust me, most of us are not judging you. Concerned? Yes. Judging? Dude, it's your health. If you have a stroke because you haven't taken your blood pressure meds or lose a foot because of untreated diabetes, there is only so much I can do to help you. On the opposite end, any controlled substance, I only take it as prescribed. I am out of it. You've gone through a 30-day supply in 20 days. No, it's too soon and I'm not filling it for cash. What you need to do is have an honest convo with your doctor about how you've been taking it, because clearly the treatment plan isn't working. Story 41, that he fell on a bushel of apples for the second time in 2 years. When radiology read the scan, they said the tumor has grown in the interim. We informed them it was an apple in the rectum. They asked how he swallowed it whole. I wish I was joking. Story 42, NAD. I was a sonographer in a high-risk obstetrics office for years. Had a patient 28 weeks pregnant with poorly controlled type 2 diabetes and a history of non-compliance come in for a scan. Asked her if she had been tracking her blood sugars, and she very enthusiastically tells me yes and hands me her chart for the past month. All of the entries were written in the exact same pen, and the numbers are way too consistent. She clearly had just filled in the values for the past month in one sitting. Story 43. I'm an occupational therapist, and one of my clinical rotations was inpatient psych. I would do grand rounds every Wednesday with our psychiatrist, resident, and third-year med students. We had a patient who would wait outside the door of our meeting room, and the minute the door cracked open, he would throw himself down and violently start seizing. We got so used to it, as it happened every Wednesday. All of us would politely step over him and say things like, "Hi, Kurt, nice day. Kurt, you aren't getting any more Klonopin today. You might want to stop that, buddy. It's probably going to make you sore." After we had all stepped over him and gone back to our respective jobs, he would calmly pick himself up off of the floor and act like nothing had happened. Typical psych ward behavior, I'm told. But as a student, it was so bizarre and eye-opening. Story 44. I'm a patient, not a doctor, but I have a good one from when a doctor lied to me. The doctor diagnosed me with inappropriate sinus tachycardia. When I asked him what we do about it, he said, "We don't need to do anything. You have a hormone imbalance that is causing this, and it will go away on its own over time." No blood work or urine had ever been done or ordered by the doctor since I had started seeing them for the issue. Side note, I have a new cardiologist. He's amazing. This has been the only doctor that has blatantly lied to me. I have been brushed off by doctors before, or had doctors in bad moods, but never lied to like this. No doctor hate here, just to this one guy. Story 45, NAD, me. Hello, sir. I'm calling to cancel your upcoming elective surgery with us due to your current COVID infection. Him. I don't have COVID, I'm fine. I'll keep the surgery date. Me. Let me look at this note in your chart. Looks like it's a televisit with your primary doctor from this morning about your cough and positive COVID test. Him. Silence. Story 46. Not a doctor, but I worked in life insurance for a while. We had an agent opening his own policy, and the requirements for the whole life he wanted was a blood test and medical exam. He did all the things, but when I declined him and his policy, he got upset and yelled via email that he doesn't do substances. Well, the positive med I see on your blood test says otherwise. Story 47. Call came by ambulance stating that the patient called 911 after his abdomen spontaneously exploded. Arrived with a gaping hole in his mid-abdomen. Quick x-ray showing 1,000 pellets in his belly. His significant other heard him, and he thought lying about it would keep her out of trouble. He lived, and she went to jail. Story 48. More than once, someone in my office called for Mr. X. Mrs. X was the one who answered the phone and basically said, "I'm the wife so you can talk me." Mrs. X was not on any consent and HIPAA was explained. Mrs. X said to hold on, then comes back on the phone using a deeper voice and says, "This is Mr. X." Story 49. An opposite story. Called the scene of unresponsive patient on a bus. Transit cop and bus driver had each tried to wake the guy up to no response. I went in and shook/yelled him awake. He looked at me all annoyed, so I asked him if he shot up today. His response was, "Ugh, I do it every day," and refused transport. His honesty, a nice change to be honest. Story 50. I've been accused by doctors of lying. I definitely wasn't. I think doctors don't realize how often the obvious lie simply isn't a lie. I've handed a doctor my chart with a broken wrist because I was distracted. It was very much broken. The scan made that very clear. I wish there had been tests as clear as that for other crap I had. Sometimes people's bodies are weird. Story 51. Way back when I was in medical school, on my emergency medicine rotation. Young man, I forget his complaint, denied recreational substances use. Later, I bent down to examine his ankles, and a used substances vial rolled out of the cuff of his jeans. Patient said, verbatim, "Man, that's my mother's. I told her not to do that crap." Story 52. Not a doctor, but friends with one. Guy brought himself in because he lost his aux cord. Explained he was bored in traffic due to bad accident and decided to experiment. Proceeds to push aux cord inside. Doesn't stop till whole cord is inserted and panics being unable to remove. I feel like there's a sounding joke here somewhere. Story 53, that he had experienced sudden cardiac arrest 2 days before and had been intubated for a day and then miraculously returned to his baseline mental and bodily functions within the day. This was a 22-year-old guy that wanted a medical report for military exemption and just didn't really understand how the body works. Story 54. Obligatory NAD but medical laboratory scientist. The most common thing I see is older folks coming in with sky-high blood glucose, necrotic toes, and large ulcers, claiming, "I've been compliant with my diabetes medication/care plan, etc." Ma'am, your A1C is the highest number my analyzer can report out, doctors of Reddit. Who's the dumbest patient you've ever had? Story 1. Young couple come in saying they have tried conceiving for almost a year, but she's still not pregnant. I start by taking her patient history. Turns out she's been on the pill for years due to period pain. Also, when I explained how the pill works and advised her to discontinue and keep trying for a baby, they didn't believe me and insisted on being referred to a fertility specialist. Story 2. Ophthalmologist here. Patient's eye wasn't getting better, so I asked if he's using his drops in the correct eye. He wasn't. He argued that his right eye is really his left eye because he throws a ball with his left hand. I argued right versus left with him for a good 5 minutes before I gave up. He won the argument. I've had 2 patients who stare at the sun. They both said it's like stargazing because the sun is technically a star. I had a blind patient who was still riding a motorcycle. He rode into a house and had to give up his motorcycle. Story 3. I thought this only happened in TV shows, but one of my sister's friends is a doctor and told us about a girl that came to the ER with abdominal pain. Yes, this is going where you think it's going. When asked, she swore up and down that she couldn't possibly be pregnant. They ran the usual tests, and wouldn't you know it, the girl was pregnant. She could not believe it. Total denial. But she did not deny having sex with her boyfriend. So the doctor, my sister's friend, asked her what birth control they used. Apples. She ate an apple after having sex with him. Story 4. My mom worked at a major hospital and heard the story of a guy who called the emergency line saying that he'd accidentally hurt himself while cutting something. Their first piece of advice was to not remove the knife, to which he replied, "What do I do if I did remove it?" And they gave him instructions. When the ambulance arrived, they found the man. Yep, he put it back in. Story 5. Worked at an urgent care for some time. Late patient comes in with mother for abdominal pain. I have a student doing the initial history and exam. Swears there is no chance of pregnancy, but is sexual active with SO. Well, we get the urine results back. She's pregnant. Student goes back in, asks the mother to step out, and has to have the most awkward conversation with this patient detailing what sex was. Well, it turns out she was indeed not having sex with a junk. The happy couple would fool around and then use the semen as lube. They thought that to get pregnant, the junk had to fall off and become the new baby. Story 6. This doesn't exactly fit the criteria, but it's close. Not a doctor, I'm a nurse, and not a patient, family members. Back when I still worked in the ICU, I had a family come in during visitation to see their loved one carrying one of those plastic containers from a grocery store bakery with half a dozen cupcakes inside. Not unusual, families would bring us food all the time, and it was incredibly nice, and we always appreciated it. Nope. I walked into the room to update them on the patient, and we talked about it also being her birthday that day. They gestured toward the cupcakes and said that's why they had the cupcakes with them. I thought that was really sweet. They were going to celebrate her birthday with her even though she was in the ICU. Then they hand me the container and look at me expectantly. I look back, unsure of what my next move was supposed to be. Aren't you going to feed them to her? This woman was on a ventilator and on IV sedation. It took me an embarrassingly long time to explain to these people why she couldn't eat while she was unconscious with a breathing tube in. Nice folks, not terribly bright. Story 7. In training, had a surgical patient. Diabetes. All shift he kept getting insulin, but his sugars wouldn't come down. Just didn't make sense. Eventually found a lot of candy under his pillow. Not sure if it's dumb or just sad. Maybe a bit of both. Story 8. I discharged a patient after he had been hospitalized for alcohol-induced liver damage. As I was getting him out the door, I impressed upon him the importance of avoiding alcohol, and he asked me sincerely if vodka was considered alcohol. Story 9. Not a doctor, but I had a lady come in complaining that she couldn't afford her medications anymore because she was smoking half an ounce of substances a day. Not a gram, but literally spending $200 per day on substances. I also had a 20-year-old guy who came in because he was feeling sick, but neglected to tell us that his junk was necrotic. We didn't know until his wife came and asked us about it a few days later. Story 10. The other day, an established patient came in for an emergency dental visit because all of his teeth were hurting worse and worse and worse, to the point where he could barely touch them with a toothbrush. The pain started a few weeks after he had started swishing with peroxide every day. He had decided he wanted less bacteria in his mouth, and he decided that swishing with peroxide would be the best way to do this. But now, every time he used the peroxide, his teeth became severely sensitive and painful to touch. Me wondering how to gently break the news to this otherwise bright guy that he was being dumb. So, have you tried not swishing with peroxide? Him. Well, no. Me. Well, and try that. No, problem solved. This is certainly not my dumbest patient encounter, but it was recent, and the only one that comes to mind at the moment. What made this patient dumb was not the fact that he swished with hydrogen peroxide. Many people do this, and it really doesn't hurt or help them. Maybe it makes them feel good. In this guy's case, it caused him a ton of pain, but he didn't realize he could just stop doing the thing that nobody told him to do. To me, that's a dumb moment. Story 11. Not a doctor, but was an administrator at an ophthalmology clinic. 1. A patient had to be prescribed some pills before his eye surgery. He returns 5 minutes after his consultation, super concerned, as he didn't know how he was going to get the pills into his eyes. Our nurse suggested that he try swallowing them. 2. Another patient had chronic dry eyes that he was seeing one of our doctors for, and one day called for an emergency appointment as his eyes were in pain. Apparently, he had heard of honey being used in eye drops to help with dry eyes, so the man put straight honey onto his eyes. Story 12. Not a doctor, but cath lab tech. Had a patient's wife sneak him a sandwich before his heart cath, not supposed to eat before since we used some sedation. And they didn't tell any of us, despite many times confirming he did not have any food or drink. The patient then threw up and aspirated during the procedure. Ended the rest of his week in the ICU and almost passed because his wife snuck him food. Please listen to your healthcare provider's instructions before procedures. These rules aren't in place to torture you, but to keep you safe. Story 13. I'm a PhD clinical psychologist, so not a physician. Patient came in for an emergency appointment. Usually these are folks who are recently assaulted, manic, or in psychosis. He filled out all our paperwork, so many questions about mental health history, and sat in our waiting room. I can't tell you how clearly this is a psychological services clinic. Finally, he gets back to my room, sits down, and pulls up his pant leg, starts taking off his cess cord. My man had ankle pain. Me. I'm really sorry you have been waiting for so long, but unless you want to talk about how your ankle pain is making you feel, there isn't anything I can do. It took a little convincing that I wasn't holding out on him. No, I wouldn't just take a quick look at it. He was baffled and kept saying, "But you're a doctor." I'm not convinced I successfully explained the difference between a psychologist and a physician. I don't even think he was substances seeking. He was freshly 18 and not the brightest bulb. He eventually limped off to the nearest urgent care. Poor kid. Hope he's okay out there. Story 14. I have a few good ones. 1. My sister's a doctor and she saw a patient and prescribed meds. Asked them to come see her a week later as a follow-up. Patient comes back next week saying that they don't feel better at all. Sister asks to see the meds she prescribed to ensure they got the right one. Patient says they never picked up the meds because they only wanted meds with organic ingredients, not one full of chemicals. 2. Husband comes in with a set of complaints. Sister proceeded to check him out and find that there was nothing wrong with him. That's when he told her that it's actually his wife who had those symptoms, and he never brought her in to get checked. On top of it, he was pissed that the doctor couldn't just fix his wife without seeing her. Story 15. Not a doctor, but work in medicine. Shout out to the patient who, in one visit, told us that insulin didn't work for her personally, and that her diabetes worked different than other people's. Also in the same visit, she tortured the poor medical student. She told the medical student that it was her 7-year anniversary. The medical student congratulated her, and then she goes, "It's the 7-year anniversary of the day he left me." Medical student was mortified, and I was super annoyed. Lady, why? How is the poor medical student supposed to know? Story 16. When I worked as a medical assistant in an OB/GYN clinic, a patient called to make an appointment because she needed a fallopian tube. I was so confused, I asked her if she was meant that she wanted to get her tubes tied. No, she said, "I'm trying to get pregnant, so I need to get a fallopian tube." Definitely booked a visit for pregnancy planning education session. Story 17. I am not a doctor, but I do work in pediatrics. I would say 90% of the time, it's the parents who are dumb, not the kids. But anyway, I am sitting in the dictation area, and a coworker is dictating her note, and I hear, "Patient comes in today after submerging his cast in the ocean and proceeding to roll around in sand." At this point, I let out a giggle and she goes, "Oh, it get worse. He has pins and the kid is 5. And the parent goes, "I trusted him not to go in the ocean." Which I have so many concerns and questions with that statement alone. You don't trust a 5-year-old and were you not watching him? The kid comes in, gets his cast off, literally saturated and there's sand everywhere, and gets started on antibiotics since he has exposed pin. A few days pass and the kid does it again. WTF parents, do your job. This one is just a fun story, not dumb. 4-year-old in a long arm cast above the elbow was playing with a beetle and it went inside his cast. When he came in, he said it stopped moving at the elbow, and sure enough, when we took the cast off, there was his beetle friend. He was very sad it was dead. Story 18. Retired GP here. I had a male patient aged mid-50s who presented with trouble urinating, decreased flow of urine, and occasional blood in their urine. I immediately referred the patient to clinical triage with a recommendation for an initial MRI to look for prostate cancer. The patient returned to see me 3 months later. Symptoms had worsened and included bone discomfort and pain. Turns out they had refused any MRI and blood tests and had gone instead to a homeopath for 3 months, utterly useless. Unfortunately, in those 3 months, the prostate cancer he had had spread to his bone. He died within 6 months. Story 19. I'm definitely not a doctor, but there was a period of about a month when my grandparents were having some concerning health symptoms. My grandpa wasn't as bad, just lethargic, but my grandma was seen with a far-off look and drooling into her lap when she was a perfectly capable woman. My family somehow found out that they both had med prescription changes after a recent doctor visit and concluded that what was happening was likely their substances interacting. They were asked if the doctor told them to get off the old meds before starting the new one. My grandpa said, "Yes, but we didn't want what was left to go to waste." My parents were in charge of periodically checking their meds after that. To be fair, my grandparents grew up during the Depression era, which could explain their reasoning. Story 20. It's like 10 p.m. and wife is on call. Suddenly, her phone almost literally blows up. 3 calls back to back from the hospital, her messaging app going off, and 2 to 3 more calls from an unknown number. She calls back the hospital and is told it's a severe emergency and woman is about to get on a plane but is having a panic attack and needs substances. My wife explains that she cannot provide that over the phone, especially just being on call. Well, the nurse, I want to say dispatcher, tells my wife, "I gave the patient your cell phone number." Wife flips, understandably, gets like 15 more calls before she answers. So my wife asks her who her doctor is at the hospital and she will try to get a hold of them. The patient's response, "I'm in this state not too close to yours. I've never been to your hospital, but I need substances now." Story 21. Not a doctor, but an embryologist. Had a man come in to do a semen analysis before starting IVF with his wife. Put him in the collection room with instructions like normal. He rang, and when I went to go grab his sample, I see that he straight up pooped in the cup. Turns out the couple had absolutely no idea on how to make a baby, and that's why they were having fertility issues. Story 22. Not a doc, but a PA. In school, had a guy come in with his very pregnant wife asking for a vasectomy. "Okay, cool, let's chat. First question," he fires at me. "Can I keep them once you've finished the surgery?" Dude thought he was getting his balls literally lost. After explaining the procedure to him and how the doc can do it in an office, he was so relieved. Got a good laugh afterwards thinking about it. Story 23. Was a med student at the time. Attic couldn't find any more veins. Looked down and saw the dorsal vein of the junk. Tried to inject there. Missed and got it into the junk. It got very infected and swollen, developed cellulitis. He tried to drain what he thought was an abscess. It wasn't, it was just cellulitis. Himself. Now it was extensive penile cellulitis with 2 wounds in it. Angriest looking junk I've ever seen. Story 24. Had a patient that super glued a crown back on their 10. He wasn't a usual patient, but his dentist wasn't open that day. He didn't get even close to down all of the way. So this crown was keeping him from closing. He got mad at me when I told him not to use super glue. He said, "Okay, smart guy, what should I use to put a crown back on?" He was giving me the smuggest I can't close all the way smile he could. In one of the rare times I got a retort out with good timing, I replied, "A dentist." My assistant ran out of the room, and I could hear her completely lose it, laughing down the hallway. The patient wanted me to fix it, which was cut off the crown and make a new one. I asked him what his medical history was. He already signed one he filled out, but I always ask because people leave stuff off, and specifically asked about heart procedures. He said he just got out of the hospital 2 days before from having 4 stents placed after a major heart attack. When I asked him why he didn't put that on his medical history form, he said, "You're a dentist, you don't need to know that." Told him I need a medical release for treatment from his cardiologist and I would not do anything until I had one. He seemed not to understand that his mouth is attached to the rest of his body. He was pretty mad. I wouldn't do what he wanted, but I didn't want to call for an ambulance that day. Story 25. In medical school, had a patient come in for abdominal pain. During my series of questions, I asked if the patient could be pregnant. She said no because she is a lesbian. The attending had us order a pregnancy test in addition to blood work anyway. Pregnancy test comes back positive. This time I asked the patient if she has had sex with a man. She responded yes, but was confused as to how she could be pregnant if she's a lesbian. My attending replied, "Honey, the sperm don't care if you're a lesbian." It blew my mind that she didn't think she could get pregnant simply because she identified as being a lesbian. Story 26. During my intern year, a male patient in his mid-20s gets admitted to the surgical floor for third-degree burns in his right hand. I go to check on him and do the normal interrogation. When I asked him how he burned his hand, he proceeds to tell me that it was a minor burn at first, just a little redness on his fingers and palm, because he touched something hot, and his friends told him that in order to heal it faster, he should boil an ointment that has cannabis with peyote and then to put his hand in it, which is how he ended up with third-degree burns. Some people lack common sense. Story 27. So, my wife's a doctor, and these are two diabetes-related stories. 1. Big guy, I split my mom's diabetes medicine with her, but I check my sugar regularly, and it's between 400 to 452. Woman complaining that the lancets don't work. She has a calloused finger. My wife suggested using a different finger. Story 28. So veterinarian, but I have a few good ones, where humans wanted me to treat them. My first week in clinical practice, I had a client that called in telling us she had taken her cat's flea medication and wanted to know what to do. She became quite hostile when we instructed her to contact human poison control and a human doctor, and insisted that because it was a veterinary substances, it needed to be treated by a veterinarian. I had another client who was convinced he had gotten worms from a puppy and decided that we needed to test his stool as well. We told him he needed to speak to his own human doctor. He got angry and informed us that he doesn't go to the doctor and defecated in the middle of our lobby. I had a client call the board of pharmacy on us because we filled her pet's medication, flea/tick/heartworm prevention, but informed her that we couldn't fill her personal medication because as a veterinary hospital, we're only allowed to fill pet med. We also offered to script out the pet meds to an external pharmacy that could handle both if she wanted to get both from the same place. The person that contacted us from the state board was just as confused as we were. I had a client bring in his own hip x-rays for us to evaluate and tried to pretend they were for his dog. He was genuinely surprised that we could tell right away they weren't from the dog. Although as far as stupid goes, I had a client who bought an Aussie Doodle from an Amish breeder and was so enthralled with him that they went back a month later looking for a mate to breed him with and was lucky enough to find a female from the same parents with the same birthday and everything. And so it must be destiny. It took us a really disappointingly long time to explain that these dogs are siblings and should not be bred. They were convinced that they couldn't be siblings because he was mounting her. They'd ironically named the dogs Luke and Leia. Story 29. I'm not a doctor, but I work in a hospital emergency department. We had a young woman who closed a car door on her hand and lost 2 fingers. She brought them. Were not able to be reattached. She was furious, yelling and smearing blood everywhere. She left AMA without letting the doc stitch her hand. A little while later, the computer showed she had checked in at the emergency department at our sister hospital. Someone wondered aloud whether she'd be able to talk them into trying to reattach, and I said, nope, and held up the Ziploc bag she'd left behind. Story 30. Obligatory NAD was an ED tech. We had a patient come in with a raging case of gonorrhea, sent him home with curative treatment and education on when he can safely have sex again, etc. DCs. I was working the desk that night, and he calls up there screaming in pain. He wanted to have sex with his girl because he just couldn't resist, so he decided to pour a bottle of Everclear on his junk to intercourse to kill the germ. Ended up dispatching an ambulance to him. He chemically burned and ended up having a urethroplasty. Story 31. My friend told me this story. She was sitting in on consults for training. This woman in her 50s came in, new patient. She reported a few symptoms, but whenever the doctor suggested a test or treatment, she refused. She then wanted a letter saying she wasn't crazy. She denied the option to see the on-site psychologist. She wouldn't leave without a letter or copy of her notes to prove she wasn't crazy for her divorce or something. So the doctor gave her a printout of the consult notes, which said she refused all treatment. She left. Happy story 32. I'll add one more, and this isn't exactly medical related, but still dumb. The hospital my wife worked for asked her if she could see Tony at 5 o'clock for a quick follow-up. 10 minutes. Now, other doctors there were it's 5 o'clock, I'm not staying into 5:01 unless I'm on call. But she said sure. She figured it was an issue with medicine and just changed the dose. Patient walks in with an entire Social Security disability packet that he needs today. My wife could have been exaggerating, but she said at least 50 pages, plus copies of his notes and records. Then proceeds to tell her, this might take longer than 10 minutes. I had to lie to get the appointment, but I can wait. Story 33. My patients are all cats and dogs, and most of them are pretty smart, but their owners? My dog doesn't need heartworm protection. We live in a gated community, so the mosquitoes respect the gates, huh? After my cat is spayed, can she still have kittens? Well, spaying is removing the entire uterus and both ovaries, so I was on the internet doing research for 2 hours, so now I know more about seizures that you do. Yes, I'm sure 2 hours on YouTube is far better than 4 years of vet school, a 1-year internship, and 50 years of practice. Okay, my dog isn't getting any better. Did you give him the medicine I prescribed? No, he didn't want to take any pills. The anti-itch medicine you gave me was great for a while, but then it stopped working. I sent him home with a 1-month supply. It is now 3 months later. Clients say so many stupid things I've stopped keeping track. Story 34. Not dumb, but with very odd priorities in my own. Crippling pain in her feet, toes deformed and bruised, and all she wanted was injections against the pain. Her cess cords were way too small, but larger ones are ugly. Utterly refused to get fitting cess cords. Sorry, it's not my job to help someone hurt themselves. At least Cinderella's stepsisters had a prince and kingdom to win. Maybe I'm just not into fashion enough? Different workplace. Dumb colleague. I asked the patient why they came to inpatient rehab. My GP said I needed a vacation. We're a trauma center, not an all-inclusive wellness resort. I don't think group therapy with severely traumatized people will be all that relaxing. And no, we don't offer daily massages. That happened more than once. Colleagues, please don't try to bind up scarce resources, even if you like the patient and they really do need a vacation. Story 35. I have a family member who is an optometrist and says he has had multiple patients come in with permanent damage to their eyes because they stared at the sun for too long. It is apparently very hard to break it to them that the eye doesn't heal itself in that way. Story 36. Eye doctor here. I have two groups of dumbest patients I see regularly. People who abuse their contact lens and end up giving themselves corneal infections and other issues, and people who don't wear safety glasses when they should be. It's not hard to take your contacts out before bed and clean them properly, or throw away if they're a daily disposable. It's not that expensive to change your contacts as directed, and it's a lot cheaper to not have to visit my office multiple times for medical visits, where I'm trying to save your eye vision from your laziness idiocy. I had a patient just this last week with 20 scars between his corneas from previous infections, a new record for me. I also take metal and other foreign objects out of people's eyes almost daily, and 99 of the time, the patient wasn't wearing safety glasses. I've had an instance where a patient had a piece of metal wire from a wire brush penetrate his eyeball, and he decided the best thing to do was pull the metal out and wait 3 days before getting it checked out. He had a case of endophthalmitis, a severe infection inside the eye that, if not treated aggressively and quickly, will make you lose your eye entirely. He needed emergency surgery and was lucky enough to have the eye saved. Another patient wasn't wearing his safety glasses and a piece of metal hit his eye. At high enough velocity, it penetrated into his vitreous and was floating there when I looked in the back of his eye. He also needed emergency surgery. Story 37. I have a family member who's a doctor who once walked into the exam room to find a young kid standing on their desk, feet on the keyboard trying to reach into the sharps container mounted high up on the wall. The mother was just sitting there letting it happen. Story 38. Dementia patients do all kinds of dumb crap like eating styrofoam. It was fine in the end. And cork. That one didn't end well. But my favorite two stories. One, young girl comes into urgent care on Christmas Day, swollen face, obviously allergic, states she's allergic to peanuts but swears up and down she didn't eat them. Family's there with her, confirms she didn't. We're trying to find out what happened in the next room over when I overhear her say that she liked the homemade satay sauce, which has peanuts as the main ingredient. Mind you, homemade by herself. Yeah, that one was dumb. Second was one of my long-term care patients whose sugars were consistently too high to measure, but she only drank water and ate only apples. Never mind that you could see the piles of candy bars on her nightstand. Favorite moment there was her going to the supermarket for fried snacks, trying to use the microwave for it and failing, setting the thing on fire as a result. Firefighters came, and the patient proceeds to stuff the blackened remains of her snack into her face, in the presence of the first responders and my team. Unfortunately, I wasn't there to see it myself, but that was a wild note to read the next day. To this day, I wonder how that patient got past 50 and didn't pass. Story 39. Family member is a physician. He once told me about a patient who was being prepped for a procedure. As he was covering known allergies, again, the patient suddenly remembered an allergy to latex gloves. The procedure was delayed as the room/materials had to be reviewed for any latex. Gloves were replaced, etc. In recovery, my cousin asked the patient why the allergy had never been previously reported/documented. Turned out that a one. The patient didn't actually know the definition of an allergy too. They simply did not like the sound and feel of latex on her skin. She would have neither heard the snap of the latex gloves or felt them against her skin due to the fact that she was going to be out the whole time. Story 40. 22-year-old burn patient life flighted in overnight. I got there in the morning and she was the talk of the burn unit. This girl was out at the bar with a group of friends of the prior night and managed to run up a $200 bar tab that she couldn't afford to pay. So her friends tell her they'll pay for her tab if she lets them pour Bacardi 151 on her and light her on fire, and she agrees to it because she didn't know alcohol was flammable. Story 41. Urologist. Had a patient come in complaining that based on her internet reading, she had a vesicopusal fistula. No history of trauma, surgery, malignancy, or infection. It's just that after sex, when she stood up, some would drip out. Story 42. When I was a student, I had a young guy come into the ER with psych complaints. He was worried about his thoughts. He said that he has these out-of-body experiences, he feels like he can't control his mind or body, and he just feels odd. I discuss with my attending, and we're about to consult psychiatry. We go and interview the patient together and discuss things further. It turns out that he gets these symptoms about 3 times per day, subsequently happens after he smokes, so he was just getting high. Story 43. I smoke met for my blood pressure. I don't take my blood sugars because the numbers are too high, and I don't like them. I can't pee until I give a urine sample. I think I can't pee because I have thyroid. Patient on substances. Favorite interaction. Doctor to patient. Did you actually stab someone? Patient. Yes. Doctor. Are they okay? PT. Yeah. It was just a little one. Story 44. My sister is a nurse practitioner and does wound care. She takes care of a lot of old Hispanic women who have diabetes. Apparently they put Vicks vapor rub on their wounds like that's gonna do anything. One lady took her sock off and lost a toe. Story 45. Firstly, I'm a nurse. This one's a bit of a 2-for-1. We had a guy present to emergency with a wound to his palm. He had been trying to remove an avocado seed by stabbing the seed with the pointy end of the knife whilst holding the avocado. The knife slipped and went through the avocado. The doctor that reviewed the patient went home that night, and while preparing dinner, proceeded to demonstrate to his wife how this dumb patient tried to remove the avocado seed by stabbing it. Literally never lived it down. Story 46. I'm an ER doctor. Some are dumb, and some are just very unintelligent or very uneducated. You guys have to realize that just by being on this thread and being able to write in full sentences, you are more intelligent than a large number of people who may have at most a 200 to 300 word vocabulary. These people get sick like anybody else. And one of the hardest parts of my job is trying to ask them questions about their symptoms while using very basic words and then interpreting their extremely disorganized and sometimes wrong answers to find a diagnosis as best I can. For instance, I've made it a habit of pointing to the areas I'm asking about because some people don't know what a chest is. I've had so many patients tell me they have no medical problems, but then their medication list is pages long and they tell me that those medicines cure them of their diabetes, high blood pressure, etc., so they don't have it. I once had a guy scream at me that I needed to give him morphine because he has a constitutional right to not be in pain. I've had a 36-ish week pregnant woman who used meth the entire pregnancy hit me in the head with a thrown object because her free turkey sandwich didn't come with the mayo already on the sandwich. I've had a guy hit straight in the neck come walking in saying he got hurt, then being shocked when I told him I had to act fast or he could die and to please get off his phone with his homies. I could pass? How? My brother, you were hurt in the neck and you're covered in blood. Oh, and so many people who use meat, but I ask if they're vaccinated against COVID as part of their screening process. And they go, EW, no, I don't know what's in that vaccine. I'm not putting it in my body, story 47. I do a lot of pregnancy tests in my job. A woman came in to initiate birth control. Husband was there too. Did a pregnancy test and it was positive. When I revealed the results, husband goes, that is impossible. I have been deployed for 12 months. Wife agreed that it was impossible. I told them that the test was accurate and that she was in fact pregnant. Husband said, you must know, since we are married, it is physically impossible for my wife to get pregnant by anyone else. No, sir, that isn't how it works. Him. Well then, who do you propose the dad is? In a very sarcastic tone. Me, Jody, in story 48, not a medical doctor, but a doctor of physical therapy. It's less wild than most cases here. But like 95% of my patients think they can stand or move for fewer than 15 minutes a day for 20 years and not have back and knee pain, and then think that I can make them be ready to climb the stairs in Positano with their grandchildren in 4 weeks. Story 49. Tech for ophthalmologist here. So many stories. Patient got a referral back to see us as they hadn't been seen in 3 years. Saw optometrist because his eyes weren't right for more than 6 months. Retinal detachment. No treatment can be done because he waited over 6 months after the fact to get his eyes checked. Story 50. Not a doc, but had a patient who would get the runs anytime he consumed dairy, but swore he wasn't lactose intolerant. Would request milks, cheese, etc. at lunch, and you'll never believe what happened after story 51. My son had pneumonia a while back, and we in a shared room. One of the patients was a kid who screamed at the top of her lungs that she didn't want to eat any medicine, and her mom took her side, and then got pissed that she wasn't getting better. Very frustrated doctors eventually gave the kid a suppository. Story 52. Not a doctor, but I would bet there's an ER doctor out there who tells the story of how my mom tried to refuse treatment for her badly broken leg because she wanted to see if it would get better on its own. X-rays showed that it was shattered. Other scans showed that a main tendon was severed. The doctor spent like 20 minutes trying to explain to her that she'd never walk again if she didn't have the surgery, and she still wanted to wait and see. Some good context is that my mom tends to freak out and say/do crazy things in stressful situations. She's smart, really. but she just falls apart under stress. They'd also given her several Vicodin. Most people get mellow on pain pills. Apparently, my mom just gets very paranoid and argumentative. She was fully convinced that the hospital staff were lying to her about how bad it was for some reason. When she started talking about going to work the next day, the doctor finally realized she was out of her mind and asked me if I would sign the release. I signed it. Story 53. One of my coworkers prescribed a patient Flagyl, an antibiotic that causes severe vomiting when combined with alcohol. She told the patient not to drink. While taking it, 2 days later, the patient presented to the ER with severe dehydration. Apparently, she took the no drinking a little too seriously. Story 54. I'm an eye doctor. You wouldn't believe the number of people who don't actually look at a bottle before they squirt the contents into their eyes and end up putting super glue or peroxide in their eyes. A less serious one. I saw a patient recently who, when I asked her where she lived, she answered the state that we're in instead of the city. I guess she technically wasn't wrong, story 55. I was the dumb patient once, and the dumbness luckily happened before I saw a doctor. When I was a kid, I asked my mom in the morning, "That injury from yesterday hurts so much I can't really walk. Can you drive me to school?" Which, understandably, made her reply completely flabbergasted. "If you can't walk because of that pain, I'm driving you to the doctor, not school." Turns out I had balls torsion, but luckily the result of several doctors inspecting and feeling and doing ultrasound was that they untangled without surgery, and I went to school in the afternoon. Story 56. Not a doctor, but worked in medical field. A boy had come in for birth control and been prescribed a diaphragm and Medix jelly. She came back a few weeks later with a raging infection. She had run out of the Medix jelly, so used G jelly instead. Also, in sex ed class asterisk, we were told about a couple who had gone on a picnic but didn't have condoms, so they used the plastic wrap from their sandwiches. Yep, she got pregnant. But probably the best story was about a man who came into the clinic with bleeding. Turns out he lost something inside end and couldn't get it out, so he tried to reach it with pliers. Nurse was, "Nope, you gotta go to the ER for that." Story 57. Once we had a patient take their own port out at home because they were done with chemo. In the process, they actually got it out of their skin, detached the port from the catheter portion without clamping it or applying pressure, and gave themselves an air embolism, resulting in a major stoke and permanent deficit. Their port removal was already scheduled in 2 weeks. Story 58. Not a doctor, but I work in healthcare. A lady came in with severe edema. She had so many health complications such as diabetes and was severely obese. We needed to get her edema under control. We sent a dietitian to speak to her because she needed to reduce her liquid intake and lower her sugar and salt intake. She seemed to really take it all in, but 5 minutes later, she was eating salty snacks, crisps, and drinking soda and juice and water, etc. It got so bad and she wasn't getting better. Her legs were in a terrible state and she just wasn't doing anything to help herself. She assumed because she was in hospital and on meds that was enough. She was discharged a few days later, readmitted to the ER, and died because she didn't listen to the doctors and dietitian and therapist. She could have lived if she stopped snacking and stuff. Really sad case. Story 59. Ear, nose, and throat clinic. Really nervous and scared middle-aged man, college-educated white-collar worker. He was there because when I open my mouth and breathe in the water during showers, I start coughing a lot. When you breathe in water, you cough? Yeah, I don't get it. Story 60. Not a doctor. My great-aunt to the optician who had just told her she had advanced glaucoma. I didn't come here to be told I had a disease. I came here to get new reading glasses. She stropped out and was dead 2 years later. Story 61. Did part of my residency in Washington, D.C. So many things stuck inside. Moral of the story. Less embarrassing to buy a device than explain how you slipped and fell on something nest first. Story 62. Heavy drinker who thought he had 2 livers. And not only that, he thought that drinking would damage them sequentially, so his backup liver was there for when his primary liver packed in. No interest in stopping drinking until he'd worn out the party liver. That or the innumerable 20-somethings who come to the ER because they literally have had a cold/sore throat for less than 24 hours. Story 63. Clueless couple struggled to get pregnant for 4 years are told by doctor the wife is still a virgin because they were having another sex. Story 64. Pharmacist that used to work in community pharmacy had a patient come in asking for a recommendation for public lice because using a can of Raid didn't work. Story 65. I'm a NICU nurse. I had a mom start crying because she didn't know how she got pregnant. So I sat down with her and found out she was only having sex in the hot tub because her boyfriend told her the heat would kill the sperm. We had a long talk about safe sex after. Story 66. My husband is in pain management, so deals with addicts trying to trick him into giving them meds/lying about illicit substances. He regularly gets patients whose urine tested positive for met. They'll say, "I've never done met," Well, your urine has met in it. Someone must have put it in there. It also tested positive for metabolizers, so that shows you ingested the met. And round it goes. Story 67. Not a doctor, but a nurse. Had a patient who repeatedly had recurring yeast infections, like bad ones. Wouldn't take diflucan because she swore yogurt would do the trick. Questioned her after observing how angry her stuff looked on her third visit as to what kind of yogurt she was eating to prevent the yeast infection. Boy, was I surprised when I found out she was applying the yogurt to her rather than eating it. Story 68. Patient intubated in the ICU. Patient wife. Patient drinks 4 liters of Mountain Dew a day. He doesn't feel good if he doesn't get that. Me. We aren't going to put Mountain Dew in his OG tube, mouth to stomach tube. Wife. Okay, why don't we just put it in his IV? Me. That would end him. Story 69. Not a doctor, but many years ago, was told by a doctor that doctors who work in the ER thoroughly dislike Memorial Day, U.S. holiday. It's the first long weekend of the summer, and all the weekend warriors get drunk and overestimate their sports abilities, and not surprisingly injure themselves, requiring a trip to the ER. One benign but dumb example. One man had been out doing sports and drinking a lot of beer. Eventually, he went home and fell asleep. While asleep, he had an extremely vivid dream in which he broke his collarbone. When he woke up, he felt perfectly fine, but the dream was so very vivid that he went to the ER to get his collarbone checked out. He was assured his collarbone was, in fact, just fine and was sent home. Story 70. Nurse but had someone who thought we physically assist them with giving a semen sample. I wish I had enough courage to tell him I'll call the male nurse for him. Story 71. I'm a patient, but I thought this was stupid. Absolutely bashed the crap out of my head. Go to doctor 2 days later because kept feeling worse, showing every concussion symptom. They tell me probably concussion, go get a CT scan. I go get a CT scan. They literally just tell me it looks fine. I took this as I'm fine, no concussion. Just being a big baby, I guess. So 4 days later, haven't been able to eat for 2 days, dizziness. The thought of food made me gag. Shaking like crazy, fever, blurring vision. Go to hospital. Oh yeah, no, you have a concussion. The CT scan just showed your brain wasn't about to explode. Why couldn't they have explained to a guy who has a confirmed head injury that his head injury could be a problem? Don't just tell me it's fine or probably a concussion. Let's see what the CT scan shows. And don't follow up with me. Could have saved a lot of headache just knowing what was going on instead of just assuming I'm conveniently sick with something unrelated and it'll pass and that it's not related to the head injury because they did a scan and said I was fine. I feel like I should have asked more questions on it all, but was I really fully comprehending what they were telling me anyway? I really doubt it.